Welcome to another episode of Washington in Focus. I'm your host, Tim Clauser, with the Center Square's Western Washington reporter, Spencer Pauly, here to talk about one of his recent stories following an audit into King County's community services department, largely responsible for opiate response, housing, other types of spending. Now, Spencer, you reported the other week an audit came out finding that there was potentially fraud, if at the very least just improper payments within the department, which is responsible for, I believe, $1.5 billion. So tell us a little bit about this audit and a press conference that went on yesterday about it.
Okay, so last week during a King County Committee of the Whole meeting, the King County Council, as the public, was made aware of a recent county audit on the Department of Community and Human Services. Now, the biggest detail that came out of this audit was that in 2023 and 2024 combined, the department distributed more than $1.5 billion. That is a 6,700% increase from $22 million in 2019 and 2020 combined. Now, Tim, that can happen just because of an increase in tax levies. You have these levy renewals within the county, but also you had a lot of federal dollars come in because of the COVID-19 pandemic, your American Rescue Plan Act. So DCHS was tasked with a lot more money to distribute through grants. And what the audit found was that there were numerous instances in which improper payments, including potential fraud, were made across these contracts and programs. And so now what we're seeing is King County Councilmember Claudia Balducci is seeking immediate reaction to this. We need to see any kind of fix to this. And so what she is proposing is a special committee of the whole meeting next week that will focus on a proposed ordinance to kind of establish a new process to ensure that these payments are checked and so that this doesn't happen again.
Yeah, I was looking through the audit in that special ordinance that they're going to talk about on that September 15th meeting. And it looks like it's kind of forwarding the 10 recommendations through the audit and just briefly going through those here. I mean, develop a comprehensive strategy linking financial stewardship to their goals, increase coordination with public health to avoid duplicate expenses, oversight, implement anti-fraud training for all staff. I particularly find that interesting. Not that it's unreasonable, but just the fact that they had to have an audit to think that they should have anti-fraud training, or the fact that they needed it all, risk assessment, and so forth. I mean, looking through the audit itself, one thing that I found particularly interesting was that, this department is responsible for about $1.5 billion. And much of that money is put out through grants. I mean, this department is responsible, I believe you said, about 90% of the county's total grants. I mean, that's, like we said,
correct,
over $1 billion. But yet this audit found that nearly half of the 359 grantees were rated high risk by the department. And I get that they had some, maybe some issues that they were trying to overcome. So they loosened some of the contracting requirements and things a few years ago to push through. But now you're managing what was a $22 million, now $1.5 billion. And almost half the people you're giving money to are rated a high risk by your own staff.
Yeah, I mean, that's exactly what the audit found, was that there's this massive increase in fiscal responsibility. And how did the DCHS respond? Well, they just reduced barriers to these contracts. And what happened is that they just didn't have a safety net to monitor if these funds were being used appropriately. I think if I look back, there were instances flagged. We talked about the potential fraud, but I think 3 grantees spending deviated significantly from budgets without any written approval, and 6 grantees were paid without consistently submitting detailed expense reports. So we're not having the checks and balances of taxpayer dollars. You have to remember, King County voters, they continue to approve renewals of these levies to support childcare, veteran support, a broad spectrum, right, Tim? And what we're seeing here is these contracts through DCHS, which received a lot of these funds from these levy renewals, they're mishandling this. And so Balducci is saying we need to show the public that we are using their funds and they can be trusted and that we're doing the right work with it. And so that's where we're at right now. Now, I think we should note, Tim, we talked about the audit, right? What they'd found. That was just a select number of contracts. We don't know the full scale of the issue because, as you said, DCHS is responsible for administering 90% of all grants. That $1.5 billion in distribution only represents a portion of what DCHS distributed. So we still have to see, and that's what Balducci is going to seek the executive's office in the future, do an internal audit to find out the full scale of this so that the county can act appropriately. And it starts with that meeting next week.
Yeah, and I saw that she's hoping to get another audit into all of the department's contracts. I mean, you noted it in your story. She's running for the executive office right now, and she's kind of the fiscal oversight underdog in this race. But I mean, yesterday she was saying, Seattle and King County taxpayers in particular have been very generous in being willing to support these massive tax levies and hand over their taxpayer dollars decade after decade. But yet, you have this audit come out that finds instances of forgery. I mean, at least one of these grantees had altered their invoices to inflate their reimbursement requests. Yep. Another organization submitted forged documents. I mean, I know not every organization is like this, but I mean, you're managing that big of a budget. You have to have these internal control mechanisms to be able to catch stuff like this. And I'm sure that King County isn't alone in this. I mean, that massive boost in funding that they got was largely attributable to the COVID-19 pandemic and an influx of federal tax dollars and then tax levies that residents had passed after that. But I mean, it makes you wonder, I mean, how many other major metros in their counties around the state or the country would face similar issues had their spending be put under the spotlight? I
think that's a good point. And I'm going to assume a lot of other counties are experiencing the same issues here, and whether or not they had their own audits on this to be determined. But I think another thing to point out, Tim, is that staffing levels within DCHS. King County, of course, has staffing issues across departments. That's no surprise for a lot of people. It's been something I've covered for years now. And I think in 2023 and 22 alone, turnover within the department's compliance team contributed to a significant underperformance. They had difficulty just hiring and retaining employees. Now, this year, the department allocated 3 new positions to the team, but that's just 3, right? And so to the auditor's office, they said this level is still below standard and that there's more work to be done, and you need to have the sufficient staffing levels to be able to examine over $1 billion worth of contract. And that's what Balducci also noted in her press conference, that is something that we need to do, is hire more staffing dedicated to keeping track of these contracts and their distributions. Yeah, I'd really be interested to see, I mean, in like-sized cities for Seattle and then like-sized counties, King County in particular, what that staffing looks like from one area to another. I mean, I know Los Angeles County is massive in comparison to King County, but I mean, how many fiscal specialists do they have that's looking at grant spending like this? And how does that compare to King County and elsewhere? I know a lot of municipal governments have issues with high turnover rates. I mean, I cover Spokane, and they're definitely not alone in that issue. But it makes you wonder, are there areas that are doing it better? Is there areas doing it worse? And where does King County kind of fall into this? But looking forward, Spencer, I mean, that meeting scheduled tentatively, I think, for September 15th, and they're going to go over this ordinance. I mean, will they vote over the ordinance at that date? When could they get some more internal controls baked into this? Well, what you're going to see next week is experts, department, DCHS experts, and also just these organizations receiving contracts, expressing their needs. And then what the committee of the whole will do is have a roundtable discussion of this. No action will be taken next week, but it sets up for whoever's the executive next year to take all that into consideration and making action. So you're going to see more work being done next year. And don't forget that there's going to be an internal audit of all of the contracts within DCHS. So the timeline, I think you'll see more happen next year. but whether or not we'll see any implementations of new laws or just any kind of regulations or operational structure changes, that'll be to be determined, Tim.
Well, I look forward to that full internal audit coming out, because I really be interested to see if any of the grantees made any errors or intentional errors in between now and that coming out. But appreciate you covering this issue, Spencer, and we'll be sure to catch your future coverage on it. And anyone else wanting to catch Spencer's stories, you can read them at thecentersquare.com. But otherwise, thank you for joining us on another episode of Washington in Focus.